Hello everyone, my name is Jake, and I recently had an L5-S1 microdiscectomy surgery performed, and today I'll be sharing with you my 6-month follow-up, and hopefully some of you find this useful. So today I'll be talking briefly about my pain levels, exercise abilities, and a couple other things. So as far as pain goes, I have no sciatic pain down my right glute and right calf where it was before the surgery. So that's a huge win. I do have some minor pain and discomfort in my lower back. It's more of a soreness, and that happens only when I've been sitting down for too long, probably 2+ hours, without getting up and walking around, or when I've lifted too many things like boxes, too much physical activity. I can also get that soreness in my lower back. I am on no medications. Ice will usually take care of that soreness I described. I use a gel pack and it works every time. I probably do that 1 to 2 times per week. After my surgery at 2 or 3 months, I was probably icing every day, and now it's only once or twice a week, so it's definitely improving. And now I'm going to share a little bit about some of the exercises that have helped me in my recovery. So regarding exercise, my neurosurgeon told me to not exercise for the first 3 months after my surgery, and to only walk during those first 3 months as a form of exercise. And that kind of surprised me because I've heard of other people who have started sooner on exercise. He was just worried about a reherniation, so I took his advice. At 3 months, I began my own form of exercise. I didn't go see a physical therapist, which could be a really good idea. But some of the things that I've done are just focus on my core, my lower back, and my abdominal muscles. And I've been trying to strengthen up the muscles around the spine to avoid a future injury. So some of the things I've done are kneeling supermans, bridges, planks, side planks, and leg lifts. And the reason I chose those exercises is that they focus on muscles around your spine, but none of them are involved with twisting or flexion around the spine. So I didn't want to hurt myself, so I started with those, and I've just been increasing the amount and the repetitions and the sets that I do, and it's worked really well. It's probably safest to go talk to your doctor or physical therapist to see what's best for you, because everyone's injury is different, which means the surgery outcome is going to be different and the recovery will probably be a little bit different. So that's probably the smartest thing you could do. One quick piece of advice that I found during my recovery is to have a good attitude and stay positive, and perhaps even find a new hobby. For me personally, I was pretty athletic prior to my surgery, and right now during my recovery I can't do a lot of those things that I used to do, such as running or hiking. I'm hoping to be able to do those things in the future, but right now I'm trying to avoid them so that I don't get a reherniation or another injury. So something that's helped me is to find other interests and hobbies to occupy my time with so that I haven't gone crazy or been too depressed. So a lot of people have asked me if the surgery was worth it, and I would answer yes. For me personally, yes, it was definitely worth it. Even though I can't do a lot of the physical activities right now that I could do before my surgery, it was still worth it. Just to have the radicular pain down the leg gone has been a night and day difference. And so I have a lot to be grateful for. Obviously everyone is a little different, and the outcomes will be different as well. Well, I hope this video has been useful to those of you who are preparing for a surgery or are recovering from your surgery. And if you follow along, I'll post a 1-year follow-up, and hopefully this can answer a couple of questions. Thanks, bye.